Hi, thank you for tuning in to this SVINute on venous sinus anatomy. So we're going to jump right in, and the most important thing to frame our discussion today is to really understand the circulation for the venous system. So that starts with understanding that the cerebrospinal fluid is predominantly made in the choroid plexus of the lateral ventricles, and then from there it's going to bathe the brain, flow through the cisterns, and then be absorbed through the arachnoid granulations. So this really shows how those arachnoid granulations are jutting into each one of those venous sinuses. And then from there, the peripheral venous sinuses are predominantly going to drain from anterior to posterior, then around around the sides of the ears and down the jugular vein. We're going to go through all of those details in the next slides. So first, we need to remember that the venous sinuses are not like arteries. They are not pipes. They are instead spaces that are created between the dural leaflets, so between the periosteal layer lining the skull and between the meningeal layer lining the surface of the brain. And so because of that, as this slide is showing, they end up being a series of trabeculated spaces. They're not just one big open channel, and they're not all created alike because of that. Also, you'll note the arachnoid granulations jutting into those channels, which also can change the shape and the size of each one of those sinuses. Now that's true for the peripheral sinuses, like I just showed you, as well as for the deep sinuses. So in this slide, this is the cavernous sinus with both a diagram and an angiogram side by side, just to show that true trabeculation, and that when you're traversing these spaces, they are not just one big open tube, but instead of more like finding the holes in Swiss cheese. So let's get through the sinuses and the venous drainage. So starting with the peripheral anatomy, what you can see at the top of the slide here is the superior sagittal sinus that's going to collect the venous drainage from the cortical veins, starting anteriorly and then draining posteriorly back to the confluence of sinuses. From the confluence, you're going to drain both sides down the transverse sinuses out laterally, and then down the sigmoid sinus into the jugular vein. Now that peripheral drainage is going to be met by the deep venous drainage as well. So we're going to introduce that on this slide and then go into some details. So you're going to have the inferior sagittal sinus that's going to be lining the corpus callosum. So again, that same C shape going from anterior to posterior. When it gets down to the inferior border, it's going to connect to that confluence by the straight sinus. Again, draining by the sigmoid sinuses and down the jugular vein. The other deep venous structures, which you can see here in the diagram, we'll look at on this next slide. So predominantly we're talking about the internal cerebral veins, and those are bilateral, the paired structures, as well as the basal vein of Rosenthal, again bilateral. They're going to converge to create the great cerebral vein of Galen, and then that is also going to empty into the straight sinus. So let's look at those individually. So for the internal cerebral vein, you want to think of that as draining all of the midline deep structures. So things like the fornix, the amygdala, the hippocampus, and of course the thalamus are all going to drain into those internal cerebral veins bilaterally, as opposed to the basal vein of Rosenthal, which is going to start collecting blood as anterior as the anterior cerebral veins, and then it's going to migrate back and around the cisterns and connect to that internal cerebral vein to create the vein of Galen. Now, it's important to note that each one of these sinus systems, both the deep sinus system and the superficial sinus system, both have anastomoses. So what I'm showing on this slide is the convergence of the superficial anastomoses. So that's going to be the superior cerebral vein, which is going to come in from the anterior surface, and it's going to anastomose with the vein of Trillard, which is going to be your predominant cortical vein that goes to the superior sagittal sinus, and with the vein of Lebay, which is going to be your predominant venous drainage going into the transverse sinus. Now, it's important to note that this is a very uncommon pattern that I've shown here on the angiogram or the venogram, where all three are about the same size. They're all co-dominant truly. Usually one is much larger, another is smaller, and that just remember that flow can go anterior and posterior through each of those channels to either drain through the more anterior deep drainage or more superficial posterior drainage. Now those variations we see every day, and so this is an example of the transverse sinuses, which in panel C are truly co-dominant, but more commonly, one is going to be dominant and the other one not. And so that's what you're seeing in A and B, where A, the left transverse sinus is going to be the dominant drainage, and in B, the right transverse sinus is going to be the dominant drainage. And so we see this on imaging every day, but the key is to note that it can actually create pathology. So if you couple that with, for instance, an arachnoid granulation at the transverse sigmoid junction, like in this slide, what you can see is that in this person, the left transverse sinus was the non-dominant sinus. The dominant drainage was through the right transverse sinus, and then you got this pinch point from that arachnoid granulation. So the pressures are shown on this slide, and you can see that this person had intracranial hypertension with a pressure of 45 in the superior sagittal sinus, but then we were able to stent that sinus to release that pressure, and the pressure did normalize on the right side of the screen as soon as that stent was placed. So just to summarize what I've shown you, hopefully everybody can recognize some of the major cerebral veins and the venous sinus drainage for both the superficial and deep venous sinus systems. There's much more complicated anatomy involved, but this gives you a kind of a high-level overview. And so I thank you for taking the time, and I hope you've enjoyed this SVINute.